The first new blood pressure guidelines in 14 years will likely bring a major change in treatment. 11 big medical groups, including the American Heart Association, are now redefining the danger zone. For the top blood pressure number, known as systolic, the bar is lowered from 140 points to 130.
The new guidelines mean an estimated 31 million more people could be diagnosed with high blood pressure. That would bring the total to nearly half of American adults. Our Dr. Narula is a cardiologist with Northwell Health. Tara, good morning.
Good morning, Charlie.
So how did they change? Why did they change? And secondly, what are the implications?
So this is a silent, deadly health crisis that we've really been under-treating. And what we now have is over 900 research studies that tell us that what we previously thought was pre-hypertension or high normal, which sounds okay, is really not okay. That risk starts to go up over a systolic pressure of 120. So by the time you're at 130, your risk of cardiovascular events has doubled. So this is really about lowering the bar, raising awareness, and early intervention. So what have we done? We've lowered the cutoff from 140 over 90 to 130 over 80. That is now stage 1 hypertension begins at that point. We have several categories. Normal is still 120 over 80. Elevated is when your top number is over 120. Stage 1 between 130 and 140 over 80 to 90. And stage 2 over 140 over 90. Now within that stage 1 group, we are using risk to kind of tell who should get medication and who should have lifestyle recommendations alone. And so if you're at elevated risk, you're going to get lifestyle recommendations and medication. If you're at a higher risk, if you're at lower risk, you're going to get lifestyle recommendations. If you're at higher risk, you're going to get medication and lifestyle.
That's a lot of numbers to pay attention to, but everybody keeps calling it the silent killer.
Right.
What exactly does it do to your body?
Well, what it is doing is essentially it's increasing the pressure in the blood vessels that supply blood to all the organs of the body. So you're slowly and silently damaging these organs over time, and it can lead to heart attack, stroke, heart failure, peripheral arterial disease like aneurysms, and it really can be a very insidious disease process. And so it's important to start recognizing it early. They're saying that with these guidelines, it's really going to affect a lot of individuals under the age of 45. It will triple the number of men under 45 now diagnosed with hypertension, and it will double the number of women, which is a good thing because we want people to pick this up early.
So what are some of the ways we can reduce our blood pressure and be healthy?
So I mentioned lifestyle, and this is kind of the cornerstone of all treatment, even for those who get medication. That means exercise, a heart-healthy diet like the DASH diet, a diet that's low in salt, a diet that's high in potassium, alcohol consumption, no more than 2 drinks a day for men, no more than 1 drink a day for women, stress management, weight reduction. All these things can lower your blood pressure by about 4 to 5 points systolically. That's very impressive. And then, of course, there is medication. Now, under the new guidelines, about 50% of Americans are not going to be meeting that cutoff where they would be controlled of a 130 over 80, and they will need to intensify their regimen with either higher doses or more drugs.
Right.
But it's really only estimated that about 4 million Americans under these new recs are going to need medication.
Thank you.
Dr. Narula.
Thank you.
Thank you.